DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there, folks. Welcome to DocTalk. I'm Dr. Dan Thompson. We're tickled that you joined us today, and we're going to have a great show. Dr. Beth Davis, who is a professor and head of the equine medicine section here at Kansas State University's Veterinary Health Center, is going to be with us today to talk about respiratory disease in horses. Thanks for joining us, and we'll see you in a minute.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. You know, these are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multimin 90 keeps them kind of level. It maintains and balances their system. The stress level is less when everything's right and working right, then they're working right.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Welcome to the show.
Hi, Dr. Thompson. How are you?
It's great. Folks, this is Dr. Beth Davis, and Dr. Davis is a friend and colleague here at Kansas State University's Veterinary Health Center. And Dr. Davis, you're a professor. You are boarded internal medicine for horses, for equine, and our section head of the equine section here. So you wear a lot of different hats and teach clinics, all the above.
Yep, it's my pleasure to be here. It's a lot of fun.
Yeah, well, we're tickled to death to have you here today, and we're going to talk about respiratory disease, which is, of course, a very common ailment in horses and many different species in humans. But I guess let's just get kind of started into what are some of the things we're going to see with those types of diseases.
Sure. So, what we usually see is a horse that presents to us with a cough and maybe some nasal discharge. And so we're asking the question, the horse has respiratory disease. What kind of respiratory disease is it? And so often what we're looking at and thinking about are, does the horse have infectious respiratory disease, or does the horse have something like allergic or non-infectious respiratory disease? And when we look at horses that have infectious disease, it's usually going to be caused by something like a bacteria or a virus. And so when the horses have those kinds of infections, they're kind of sick. And so clinical signs are usually going to be that the horse is quieter than usual. Maybe he doesn't want to work, or if you try to work him, he can't do very much. He probably has a fever, and so he's going to feel warm. And then when we check his temperature, he actually has an elevated temperature, and he's probably not eating very well. Along with that, the horse is going to have a cough and some nasal discharge.
Sure. And then in non-infectious, similar type symptoms, but maybe not a fever?
Right, exactly. So horses that have non-infectious respiratory disease, they're usually still going to be relatively bright and alert, eating okay, especially with more mild forms of disease, but they may have a cough. Typically, they are not going to have a fever.
So, one of the things that I think that we always get into, and I always remember my granddad, who was a veterinarian, he'd say, you should have called me a week ago, and when we're dealing with respiratory disease, can some of these progress pretty quickly, or can the horse go downhill? And I guess what I'm getting at is, how do people know when to call the veterinarian?
You bet, absolutely. And so, a little bit is knowing the horse, but when we're talking about things like infectious disease, sometimes we know if we've done good preventative health and the horse is well vaccinated and we've taken care of some of those things in a proactive approach. But if the horse does develop signs of infectious respiratory disease, fever, cough, nasal discharge, sometimes we're going to take a wait and see approach as far as make sure they're doing okay, they're eating, they're drinking, they're stable. And if it's something like a mild viral disease, it may run its course in 2 or 3 days. Other horses in the farm may be susceptible to getting it, but that horse may run a course. If it's bacterial disease and the horse is progressing, then we need to probably call the veterinarian. The horse is getting a little bit worse.
Cool. Well, it's a great time to take a break. Folks, when we come back, we're going to have more with Dr. Davis on equine respiratory disease, and we're going to talk about some of those infectious types of respiratory disease. You're watching DocTalk, and we're glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. And by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition. Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300 LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300 LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300 LA is the practical choice for your herd.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd.
Folks, welcome back to DocTalk. I'm Dr. Dan Thompson. I'm joined today by Dr. Beth Davis. Dr. Davis is a professor and clinician here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. She's boarded in internal medicine for equine internal medicine. I'll get spit out here in a second. But we're talking about respiratory disease. And as we kind of, infectious versus non-infectious, and then we went into the tree of the infectious being either bacterial or viral. Let's kind of jump into some of that on what we're going to see with those two and maybe what causes them.
Okay, sure. So again, with infectious disease, we usually have a horse that's kind of quiet, not feeling themselves, has a little bit of a fever and coughing and some nasal discharge. And so when we look at horses that maybe have viral respiratory disease, some of the viruses that we can encounter are things like equine influenza, equine herpes virus, and we have a couple different types of equine herpes virus that can cause infectious respiratory disease, and specifically EHV1 and EHV4 are the ones that we most commonly think about. And I think it's valuable for people to know about these viruses because we do have vaccines that are available that can help to prevent infectious respiratory disease because of these viruses.
So vaccination, very important.
Vaccination is important, and it's particularly important for horses that are out and work for a living and go to horse shows, go to rodeos, and they're around other horses or in an environment where horses are coming and going quite a bit.
Viruses are pretty easy to communicate between horses, right?
Absolutely, absolutely. And even the caretakers and the riders and tack being exchanged between horses can be methods of transmission, you bet.
I'll be. So after the viral, we have the bacterial infections, and so it's a different class of pathogen.
Right.
Right. What are we looking at with those types of pathogens?
Yep. So bacterial disease, I would say most commonly we're going to deal with 2 different forms of streptococcal challenge. And so Streptococcus zoepidemicus is going to be the most common bacteria that we deal with when it causes a problem in the lower respiratory tract. And a pretty common scenario would be a horse after long distance transport, say greater than 500 miles, going across the country to go to a big horse show or a sale. And then another form of bacterial disease would be the bacteria called Streptococcus equi, which is the one that causes strangles. And that's where in the young horse we get enlarged lymph nodes and abscess drainage and that sort of thing. So those are the most common bacterial types of respiratory disease.
And treatment of the bacterial are going to be generally with an antibiotic once we have them.
Right, and that's where it's really valuable to work with your veterinarian, for horse owners to work with their veterinarian to determine the necessity for antibiotics, but especially with something like strep zoo, it's important to get them on antibiotics and get them cleared up as quick as possible.
Wow. Well, some really good stuff. We're about 30 seconds from a break here, so we'll take our break.
Okay.
But when we come back, we'll get into some of those non-infectious respiratory disease, which as we discussed offline, is very important cause of respiratory disease, and a lot of people struggle with it in their horses.
Absolutely. Sounds great.
Thanks for being here.
You bet.
Thank you for being here. And as we take a break, we'll be back more with Dr. Beth Davis.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, it's Dr. Dan with your On the Farm tip, and today we're going to talk about downed animals, specifically beef cows. When we have downed animals, we can't move those animals by dragging them or lifting them with chains. What we have to work with is we have to pick those animals up to move them to a different location. You're going to want to use a sled, a lowboy, the bucket of a loader, something like that to move those animals. Once you've moved them, you need to make sure that you provide shelter, nutrition, and water for these animals. As they continue to respond and rise, those animals will go back into production. If they don't, make sure that you consult with your local veterinarian and make sure this animal gets the best possible care. You're watching Dr. Thompson here on DocTalk on your On the Farm tip, and we'll see you down the road.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Baytril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytril 100, right the first time.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
We do use multi-min in our cow herd, and we're finding that there is a benefit. It seems like those cows breed back better. And we also found that by giving our bulls a shot of multi-min just before we turn them out, we really get a kick out of that. I've definitely recommended multi-min to several people, and it's a good product.
This segment is brought to you by Fink Beef Genetics. Our 23rd annual bull sale featuring 400 Angus and Charolais bulls is Wednesday, October 30th. Contact us at 785-293-5106 for more information and to be added to our mailing list.
Folks, welcome back to Doc Talk. It's a pleasure to have you join us today, and it's a pleasure to have Dr. Beth Davis, who is our section head of the equine area of the Veterinary Health Center. She's a professor and boarded in internal medicine for equine. We're talking about equine respiratory disease, and we talked about the infectious types of respiratory disease, but now let's move into the non-infectious, and these are some things that people deal with quite a bit.
Yeah, absolutely. So people that have performance horses, we have them because we want to ride them, and sometimes horses will have problems with coughing. and maybe they're not working at their ideal level. And so there are a couple forms of non-infectious respiratory disease that horses can suffer from. And when we're looking at the younger group of horses that have a little bit of a cough and maybe not working at their full potential, we're usually dealing with a condition called inflammatory airway disease. And sometimes this is secondary to a previous viral respiratory disease where they have some persistent pulmonary inflammation. They've got some white blood cells and mucus down in their lower airways. And we have to help get that cleared up so that they can have good pulmonary function. In our older horses, especially horses maybe that are in certain environmental conditions, like maybe we've had a lot of rain, horses have to come into the barn and they're exposed to hay and straw and some of the molds associated with that bedding. And in those older horses that have coughing, sometimes they're dealing with recurrent airway obstruction or heaves. And those horses really have to be maintained pretty carefully so that we can minimize the inflammation, white blood cells in their lower airways, so that they can have a good quality of life and hopefully stay in some athletic work.
Gosh, so there really is a difference in the age of the horses. Is the reason what was the reason why the younger horses is it exposure or length of time of exposure to something like this?
Right. It's a really good question, Dan, and it's one that is being explored. In some settings, we ask the question, does a horse that has inflammatory airway disease when they're 3 or 4 years of age, are they predisposed to developing heaves when they're 15 or 18 years of age? We're not quite sure, not necessarily, but most commonly the young horse gets inflammatory airway disease, as I said, following some other form of infectious disease, and they're just a little bit slow to clear it up, kind of like kids sometimes, where they have a little bit of a hard time completely getting over that cold or flu that they had. Those older horses, they truly do have an allergic condition. So it's because of certain molds that are in the hay or in the straw that they get exposed to that trigger an allergic response, and it causes them to cough and have mucus production in their lungs.
And so when we're looking at of course there are therapies and things to that nature that we can do, but reducing dust, just management things around the farm help with these types of situations?
Yeah, absolutely. So the older horse that has heaves, one of the most important things that we can do is move them out of that environment that has the triggers, the allergens that set them off. Interestingly, in certain parts of the country, especially in the southeast, there's actually a pasture-associated form of heaves. And so in those horses, getting them out of that environment. But environment is really key for those horses.
Cool. Well, folks, we're going to take another break. Dr. Davis, thanks for being here.
Thank you very much.
And when we come back, we're going to do kind of a wrap-up on equine respiratory disease with Dr. Beth Davis. We appreciate you joining us here today. We sure hope you're enjoying the show, and we'll see you in a minute.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
From Kansas State University, this is Agriculture Today. New data out of several Plains states suggests that the actual growth improvements in commercial cow herds has been very modest in recent years, and a guest speaker at K-State's recent beef conference, Oklahoma State University's Dave Lallman, reads this to mean that more emphasis should be put on efficiency in cow herd production.
Those 3 different data sets actually show very little to no improvement in calf weaning weights in commercial cow-calf operations. So the context there, I think, is operations that operate with low inputs. They don't spend a lot of money on, say, supplement or try to minimize hay feeding and so on.
This is K-State Research and Extension.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center, and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
American innovation is being driven in places you might not expect by people like Brent Hayek, an Oklahoma family farmer, who recently set a world land speed record in a Ford Super Duty pickup truck powered by renewable B20 biodiesel. Advanced performance is here, now, putting America on the fast track to more jobs and energy independence. Biodiesel, America's advanced biofuel.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to the show. Dr. Davis, thank you for being here. Folks, this is Dr. Beth Davis, who is a boarded equine internal medicine specialist here at the Veterinary Health Center, and she's the section head of our equine section in our hospital at the College of Veterinary Medicine. We've had a great discussion today about equine respiratory disease, and appreciate you being here. And thought maybe we just kind of go through a recap then of things that we've talked about today, and start out with the infectious versus non-infectious type.
Sure, absolutely. And so I think with infectious disease, it's ideal and prevention is always the key. And so thinking about what can we do to help keep our horses nice and healthy. And so having a good management program, having the vaccines current and up to date, especially in this context when we're talking about viral respiratory pathogens, things like influenza, equine herpes virus 1 and 4 that cause rhinopneumonitis. And then when we're thinking about things like the potential for exposure and the development of contagious disease, we have to think about being careful when we're on the road, when we're around other horses, make sure that we're as healthy as possible and minimize exposure to horses that aren't healthy. And then to use really good practices for things like long distance transport so that we can minimize some of the complications that could occur for going 100 or 500 or even 1,000 miles on the road, because horses can aspirate and pick up dust and particles on the road.
Similar with cattle, shipping fever, type of deal, and we see it in all animals.
Yep.
I think I even get a touch of it when I drive long distances.
Yep.
And then treatment, getting a veterinarian involved.
Exactly. So if the horse isn't right and it's been going on for a period of time, especially if the horse has a big fever and isn't eating well, isn't drinking properly, call your veterinarian and get the veterinarian involved, and then we can identify whether that horse needs help and say there's bacteria present. We might need to put that horse on some antibiotics and get them cleared up.
Cool. Then let's move to the non-infectious. What are some of the things that we said younger horses versus older horses? And
Yeah. So the horse that is younger, that has a cough and has maybe a dusty environment, trying to work on that environment until we get things cleared up. And a lot of times working with the veterinarian, reducing inflammation with medications is going to be important. The older horse that has heaves and has a tendency in certain environmental conditions with hay and straw and dust and those sorts of things to have exacerbations of respiratory difficulty, then making sure we control that environment and try to have it as appropriate as possible for that horse to minimize that trigger of inflammatory airway.
Sounds like there's a lot of management involved and environmental management when we're talking about some of these diseases.
Yeah, absolutely.
Well, it's been a great show, and we appreciate all that you do, not only at K-State, but nationally and internationally for equine medicine.
Well, thank you, Dr. Thompson. It's great to be here.
Folks, thanks for joining us today. You've been watching DocTalk, and if you'd like to know more about what Dr. Davis and I do here at Kansas State's College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember, we always recommend that you work with your local veterinarian. You've been watching DocTalk. We're glad that you joined us. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection,